Up next on the show, what you need to do if you have a rapid or irregular heartbeat.
And still ahead, Christmas in May. We'll tell you where they're getting ready to shoot a holiday film right here in Wisconsin when we come back. And welcome back. Well, a rapid or irregular heartbeat, if left untreated, can cause blood clots, which may lead to a stroke or even worse.
And joining us now to discuss atrial fibrillation is Dr. Ryan Cooley. He is an electrophysiologist with Aurora Cardiovascular Services. I don't know if I can get any more big words into that introduction. Nice to have you on the show today.
Thank you. Good morning.
I think this is an important thing to talk about, in part because if people recognize the signs of this, or they can identify it, and the quicker they can do that, the more likely the outcome is to be positive, right?
Correct. That's absolutely correct. There are a lot of symptoms that can arise from atrial fibrillation. People can have fatigue, shortness of breath, chest pain, palpitation, which is a sensation that the heartbeat is going on in the chest irregularly and beating fast.
And it is, right? It is beating fast or irregularly.
That's correct.
Okay, and a lot of times you can feel that.
Yeah, absolutely. And I think it's important to note that men and women actually differ in how they manifest atrial fibrillation, that women tend to be more symptomatic than men. And they often endure these symptoms. And they have a higher risk of stroke than their male counterparts. And despite this, women continue to be undertreated compared to men.
Is it because some of the symptoms are so confusing? I mean, you might think you have what's like heartburn, or you might just think that you've had too much caffeine and you have a little flutter. Is that the reason why so much of it is not why we don't go to a doctor to check it out?
Yeah, I think that's part of it. It can present in a long line of symptoms. It can be completely asymptomatic, or you can have really significant symptoms, like you can all of a sudden suffer a stroke, or you can develop heart failure. So it has such a broad range of presentation that it sometimes doesn't lead you to the doctor.
Well, and in 15 to 20% of all strokes are attributed to this. So I always wonder what causes it then. What are the causes of AFib?
It's an upper chamber rhythm problem. So the upper chambers are not contracting normally. Normally when you have a regular, completely normal heartbeat, they're contracting and blood is moving through normally. When the atria fibrillate, they're kind of squiggling and they're not contracting, the blood stagnates. And when blood stagnates, clots form, and then the clots can break off.
Is this something that's genetic, or is it caused by lifestyle habits?
Well, the causes of AFib can be divided into two categories. One is non-modifiable, which would be age and genetics. Those are things you can't do much about.
Right.
And modifiable causes. So the modifiable causes are things like high blood pressure, sleep apnea, both of which have been linked to obesity, alcohol and tobacco overuse, and chronic stress and the inflammation that follows. It is really a disease that closely tracks inflammation and kind of wear and tear in the body.
Are there some things you can do to prevent it? I mean, obviously you can make lifestyle changes like losing weight, drinking less, using less tobacco, or eliminating it altogether. Are there other things you can do?
Absolutely. It's a great question. I think prevention is really the key, and that means sleeping more, eating and drinking less, having better overall nutrition, smiling more.
Laughing.
Yeah. And moving a lot. It probably doesn't matter so much the type of exercise that you engage in, although I'll mention that there was a recent study that showed that yoga activity actually reduced reduced the incidence of atrial fibrillation.
Do you think it's because of the physical attributes that you get from yoga, or is it the de-stressing? Because stress seems like it's a big thing.
Absolutely. It's probably multiple factors.
Okay.
It helps control other risk factors like the high blood pressure, and it helps manage weight. But yoga in particular is very relieving. It's a stress reduction activity, and so it's probably a number of factors.
Okay.
Yeah. I was just going to ask about treatment.
Yeah.
Well, people with AFib after lifestyle change really face some tough choices. They can live with it. That doesn't seem so nice. They can take medications, or they can have something called ablation. Unfortunately, medications are not ideal. The default thinking that taking a pill is less risky than a procedure really doesn't apply to rhythm controlling medication. They do confer some real risk. Ablation, on the other hand, has shown a lot of promise, and that's not to say it's risk-free. It's a minimally invasive procedure that is designed to actually damage tissue that is causing AFib. And that can be accomplished through a technique called cryoablation, which is freezing, or burning, which is radio frequency.
Okay.
It's a superior strategy, both in terms of quality of life and in reducing stroke rates. And there's even data that it may actually lessen dementia.
Those are all important reasons to consider it,
Absolutely.
I would think.
Yeah, I think if you have any of the symptoms of, chest pain, confusion, dizziness, fatigue, palpitation, short of breath, swelling in the feet, any of those all could be symptoms of AFib. You should contact Aurora St. Luke's. You can meet with an AF expert. They're available at one of the many Aurora hospitals and clinics close to your home or work. You can call them toll free at 888-505-9323 to schedule an appointment, or visit them online at aurora.org/AFib as well, and that's where you can find Dr. Cooley too. Thanks for being here, Doctor. We
Thank you
appreciate
very
it.
much.
Really nice to have you. Thank you.